Do you suffer from bloating, gas, constipation, diarrhea, brain fog or fatigue? It may be that you have leaky gut syndrome. Hello and welcome to this educational video. My name is Dr. Peter Holsman and I am an integrative medical doctor in Ashburton. Are any of these symptoms familiar? Digestive disorders such as bloating, gas, gut pain, diarrhea or constipation are symptoms of leaky gut. And there's also evidence that symptoms such as brain fog, joint pain, fatigue, especially after eating, as well as food sensitivities may be associated with leaky gut. What happens in leaky gut? Well, leaky gut, otherwise called intestinal permeability, is a breakdown of the joins or junctions between the cells that line and protect your intestine. And you need a healthy gut lining to filter out large undigested chunks of food particles or clumps of bacteria so that you only absorb healthy tiny food particles and great nutrition. I mean, think about what would happen if you used a broken sieve with large holes to drain water from freshly cooked spaghetti, or to prepare a cup of herbal tea. So in a similar way, you need your gut lining to be a really effective, good quality sieve. There are many diet and lifestyle factors as well as infections that cause digestive problems and leaky gut. And these include inflammatory foods. For example, sugar, alcohol and some processed foods will generally increase inflammation and damage the lining of your intestine. And they can also feed bad gut bacteria and yeast such as candida. Food sensitivities and food allergies can encourage leaky gut. And stress and poor quality sleep are well known to increase gut permeability and hence all the other symptoms and problems. Antibiotics can be bad news for your beneficial healthy bacteria and leave you vulnerable to getting other sorts of infections. I mean, how many people have had diarrhea or thrush after taking antibiotics? Alcohol, anti-inflammatory medications and other prescription drugs can also increase intestinal permeability. And bad bugs, otherwise known as intestinal dysbiosis, whether from an overgrowth of bacteria, parasites or yeast, are a well-recognized contributor to leaky gut. So what are some helpful diet changes? Well, there are several main diets, and the three best known diets are the low FODMAP diet, the gluten-free diet and the paleo diet. And the right diet for you is the one that your body responds to best. And perhaps the most important point is that you need to avoid whichever foods are triggering your symptoms. I mean, think about if you burnt your hand on a hot stove, you'd quickly learn to avoid burning your hand again. And it's similar with food choices. Does it make sense that you'll be better off when you minimize or avoid foods that cause you pain, bloating, or other symptoms of inflammation? So perhaps it's time to change some habits. And simple changes to your daily habits can significantly improve leaky gut. You don't need to necessarily do all of these things to experience a benefit, but it's quite likely that one or two of these areas can do with some improvement. And here you can read that it's to do with exercise, sleep quality, stress management, alcohol consumption, and it's worth emphasizing the more you can chew your food well, the easier it is that your gut's going to relax and digest the food effectively. There are a number of different healing supplements. Probiotics improve the health of the gut bacteria and help to maintain a healthy barrier. L-glutamine is an amino acid that's got a lot of research showing its restorative and repair properties for the gut lining, especially during times of stress. And vitamin D seems to help maintain immune system balance, both within the gut and generally throughout your body. Well, if you have any of the symptoms described earlier, such as bloating, wind, gas, fatigue, diarrhea or constipation, it's time to take action because you really need a healthy gut for optimal health. Thank you for watching this educational video on leaky gut. My name is Dr. Peter Holsman and I am an integrative medical doctor in Ashburton. You are welcome to see me for help with your health concerns. Please leave any comments or suggestions for future videos below. Thank you again. Dr. Peter Holsman signing off.